Hello, welcome to my channel. Subscribe or like if you like it. Today we are going to talk about the medicine esmperzol with brand name, Nexium. We will explain its mechanism of action, side effects, dosage, uses, contraindications, warnings, pregnancy and answer questions such as, what is esmperzol and how does it work? What are side effects associated with using esmperzol? What other drugs interact with esmperzol? And what are warnings and precautions for esmperzol? What is esmperzol and how does it work? Esmperzol is used to treat certain stomach and esophagus problems, such as acid reflux, ulcers. It works by decreasing the amount of acid your stomach makes. It relieves symptoms such as heartburn, difficulty swallowing, and persistent cough. This medication helps heal acid damage to the stomach and esophagus, helps prevent ulcers, and may help prevent cancer of the esophagus. Esmperzol belongs to a class of drugs known as proton pump inhibitors, PPIs. Esmperzol is available under the following different brand names, Nexium, and Nexium 24HR. Dosages of esmperzol. Dosage forms and strengths. Capsule, delayed release, as magnesium. 20 mg, Rx/OTC 40 mg. 24.65 mg, strontium salt, adult only 49.3 mg, strontium salt, adult only tablet delayed release, as magnesium. 20 mg. Injection, powder for reconstitution. 20 mg/vial. 40 mg/vial. Packets for oral suspension. 10 mg. 20 mg. 40 mg. Dosage considerations should be given as follows. GERD without erosive esophagitis. Adult. 20 mg orally once/day for 4 weeks. Consider an additional 4 weeks of treatment if symptoms do not resolve completely in the first 4 weeks. Pediatric. Oral. Children under 1 year, safety and efficacy not established. Children 1 to 12 years, 10 to 20 mg orally once/day for up to 8 weeks. Children older than 12 years, 20 to 40 mg orally once/day for up to 8 weeks. Intravenous. 4. Short-term treatment of GERD with erosive esophagitis when oral therapy is not possible or appropriate. Children under 1 month, safety and efficacy not established. Children 1 month to 1 year, half a mg/kg intravenously, 4, once/day. Children 1 year and older, less than 55 kg, 10 mg for once/day. Children 1 year and older, 55 kg and greater, 20 mg for once/day. GERD with erosive esophagitis. Adult. 20 to 40 mg orally once/day for 4 to 8 weeks. If oral therapy inappropriate or not possible, 20 to 40 mg once/day intravenously, 4, up to 10 days, switch to orally once patient able to swallow. Maintenance, 20 mg orally once/day for up to 6 months. Pediatric. Children under 1 month, safety and efficacy not established. Children 1 month to 1 year. 3.5 kg, 2.5 mg orally once/day for up to 6 weeks. Greater than 3.5 to 7.5 kg, 5 mg orally once/day for up to 6 weeks. Greater than 7.5 kg, 10 mg orally once/day for up to 6 weeks. Children 1 to 12 years. Less than 20 kg, 10 mg orally once/day for 8 weeks. 20 kg or greater, 10 to 20 mg once/day for 8 weeks. Children over 12 years. 20 to 40 mg orally once/day for 4 to 8 weeks. Maintenance, 20 mg orally once/day up to 6 months. Helicobacter pylori eradication. Combination therapy, with amoxicillin and clarithromycin, For eradication of H. pylori in patients with duodenal ulcer, 40 mg orally once/day for 10 days, plus amoxicillin 1000 mg orally every 12 hours for 10 days, plus clarithromycin 500 mg orally every 12 hours for 10 days. Risk reduction of NSAID-associated gastric ulcer. 20 to 40 mg orally once/day for up to 6 months. NSAID-induced gastric ulcer. 20 mg orally once/day for 4 to 8 weeks. Zollinger-Ellison syndrome. 80 mg orally divided every 12 hours. Initial, adjust regimen to efficacy, up to 240 mg orally once/day, or 120 mg orally every 12 hours, administered to patients' gastric or duodenal ulcers following therapeutic endoscopy. Intravenous. 4. Indicated for risk reduction of rebleeding of gastric or duodenal ulcers following therapeutic endoscopy in adults. 80 mg 4 infused over 30 minutes, then continuous 4 infusion of 8 mg/hour for total treatment duration of 72 hours. Follow 4 therapy with oral acid suppressive therapy. Frequent heartburn. Over-the-counter, OTC, 20 mg orally once/day for 14 days. Hepatic impairment. Oral administration. Mild to moderate, child PUA-B, no dosage adjustment required. Severe, child PUC, not to exceed 20 mg/day. Gert, intravenous. 4. Mild to moderate, child PUA-B, no dosage adjustment required. Severe, child PUC, not to exceed 20 mg/day. 4. Bleeding gastric or duodenal ulcers, intravenous. 4. No dosage adjustment required with initial 80 mg/30 minutes. 4. Dose adjust dose for continuous 4 infusion. Mild to moderate, child PUA-B, not to exceed 6 mg/hour. Severe, child PUC, not to exceed 4 mg/hour. What are side effects associated with using esomeprazole? Common side effects of esomeprazole include headache, gas, flatulence, indigestion, nausea, abdominal/stomach pain, diarrhea, dry mouth, dizziness, constipation, drowsiness, itching, vomiting, rash, nervousness. Less common side effects of esomeprazole include blood and lymphatic system disorders, agranulocytosis, pancytopenia, blurred vision, GI disorders, pancreatitis, stomatitis, microscopic colitis, hepatobiliary disorders, liver failure, hepatitis with or without jaundice, anaphylactic reaction/shock, gastrointestinal, GI, candidiasis, low blood magnesium, hypomagnesemia, musculoskeletal disorders, muscular weakness, muscle pain, bone fracture, nervous system disorders, hepatic encephalopathy, taste disturbance, psychiatric disorders, aggression, agitation, depression, hallucination, interstitial nephritis, breast enlargement in males, bronchospasm, skin and subcutaneous tissue disorders, hair loss, erythema multiforme, hyperhidrosis, photosensitivity, Steven-Johnson syndrome, toxic epidermal necrolysis, sometimes fatal. Post-marketing side effects of esomeprazole reported include cutaneous and systemic lupus erythematosus, cyanocobalamin, vitamin B12 deficiency, Clostridium difficile associated diarrhea. This document does not contain all possible side effects and others may occur. Check with your physician for additional information about side effects. What other drugs interact with esomeprazole? If your doctor has directed you to use this medication, your doctor or pharmacist may already be aware of any possible drug interactions and may be monitoring you for them. Do not start, stop, or change the dosage of any medicine before checking with your doctor, healthcare provider or pharmacist first. Severe interactions of esomeprazole include erlotinib, nelfinavir, rilpivirine. Esomeprazole has serious interactions with at least 21 different drugs. Esomeprazole has moderate interactions with at least 64 different drugs. Esomeprazole has mild interactions with at least 37 different drugs. This information does not contain all possible interactions or adverse effects. Therefore, before using this product, tell your doctor or pharmacist of all the products you use. Keep a list of all your medications with you, and share this information with your doctor and pharmacist. Check with your healthcare professional or doctor for additional medical advice, or if you have health questions, concerns, or for more information about this medicine. What are warnings and precautions for esmperzol? Warnings. This medication contains esmperzol. Do not take Nexium, or Nexium 24HR if you are allergic to esmperzol or any ingredients contained in this drug. Keep out of reach of children. In case of overdose, get medical help or contact a poison control center immediately. Contraindications. Hypersensitivity to esmperzol or other proton pump inhibitors, PPIs. Effects of drug abuse. No information available. Short-term effects. See what are side effects associated with using esmperzol? Long-term effects. Published observational studies suggest that PPI therapy may be associated with an increased risk for osteoporosis-related fractures of the hip, wrist, or spine, particularly with prolonged, more than 1 year, high-dose therapy. Low blood magnesium levels, hypomagnesemia, may occur with prolonged use, i.e., greater than 1 year. Adverse effects may result and include tetany, arrhythmias, and seizures. In 25% of cases reviewed, magnesium supplementation alone did not improve low serum magnesium levels, and the PPI had to be discontinued. Consider monitoring magnesium levels prior to initiation of PPI treatment and periodically. Daily long-term use, for example, longer than 3 years, may lead to malabsorption or a deficiency of cyanocobalamin. See what are side effects associated with using esmperzol? Cautions. Proton pump inhibitors, PPIs, are possibly associated with increased incidence of Clostridium difficile-associated diarrhea, CDAD. Consider diagnosis of CAD for patients taking PPIs who have diarrhea that does not improve. PPIs may decrease the efficacy of clopidogrel by reducing the formation of the active metabolite. Severe hepatic impairment. Cutaneous lupus erythematosus, CLE, and systemic lupus erythematosus, SLE, reported with PPIs. Avoid using for longer than medically indicated. Discontinue if signs or symptoms consistent with CLE or SLE are observed, and refer patient to specialist. Most patients improve with discontinuation of PPI alone in 4 to 12 weeks. Serological testing, for example ANA, may be positive, and elevated serological test results may take longer to resolve in clinical manifestations. Relief of symptoms does not eliminate the possibility of a gastric malignancy. Consider additional follow-up and diagnostic testing in adult patients who have suboptimal response or early symptomatic relapse after completing treatment with a PPI. Breastfeeding therapy increases risk of Salmonella, Campylobacter, and other infections. Contains enteric-coated granules. Acid label, do not chew or crush, take 1 hour before meals. Published observational studies suggest that PPI therapy may be associated with an increased risk for osteoporosis-related fractures of the hip, wrist, or spine, particularly with prolonged, more than 1 year, high-dose therapy. Decreased gastric acidity increases serum chromogranin A, CHA, levels and may cause false positive diagnostic results for neuroendocrine tumors. Temporarily discontinue PPIs before assessing CHA levels. Low blood magnesium levels, hypomagnesemia, may occur with prolonged use, i.e., greater than 1 year. Adverse effects may result and include tetany, arrhythmias, and seizures. In 25% of cases reviewed, magnesium supplementation alone did not improve low serum magnesium levels, and the PPI had to be discontinued. Consider monitoring magnesium levels prior to initiation of PPI treatment and periodically. Daily long-term use, for example, longer than 3 years, may lead to malabsorption or a deficiency of cyanocobalamin. Acute interstitial nephritis reported in patients taking proton pump inhibitors. May elevate and or prolong serum concentrations of methotrexate and or its metabolite when administered concomitantly with PPIs, possibly leading to toxicity. Consider a temporary withdrawal of PPI therapy with high-dose methotrexate administration. Pregnancy and lactation. Use oral esmperzol during pregnancy with caution if benefits outweigh risks. Animal studies show risk and human studies are not available, or neither animal nor human studies were done. Intravenous esmperzol may be acceptable for use during pregnancy. Either animal studies show no risk but human studies are not available, or animal studies showed minor risks and human studies were done and showed no risk. It is unknown whether esmperzol is distributed into breast milk, discontinue using the drug, or do not nurse.